Hi, it's Patrick Hutzler from IntensiveCareHotline.com with another weekly update. Today I want to show you how to always achieve your goals whilst your loved one is critically ill in intensive care. I know this sounds challenging and daunting. However, there are ways of how you can always achieve your and your critically ill loved one's goals whilst your loved one is critically ill in intensive care. First of all, let's imagine a couple of the most common scenarios if your loved one is critically ill in intensive care, where you think that achieving what you want is far out of sight. Generally speaking, the two most common scenarios are: number one, your loved one is so sick and unwell in intensive care that they either face a long-term stay in intensive care to get better, and if they do get better, they may face major negative impacts on their future quality of life. And number two would be your loved one is so sick and unwell that he or she is most likely to die in intensive care. Those two scenarios are relatively common situations in intensive care, leaving families of critically ill patients distressed, frustrated, vulnerable, overwhelmed and frightened. And the last thing on their mind is usually how they can turn the situation around and feel like they can get what they want. The frustrations, the stress, the overwhelm and the confrontation of the situation, the lack of peace of mind and sometimes the hopelessness are just massive, and nobody usually gives you any advice on how to, number one, cope with the situation, and number two, turn it all around and get what you want for your critically ill loved one and for your family. You see, one thing that I learned over the many years in intensive care when supporting families of critically ill patients in intensive care through difficult and heartbreaking situations, including challenging end-of-life situations, is that the only thing that stands between you and achieving what you want in your difficult situation is your mindset. However, your mindset is absolutely critical in your difficult situation, and it's often the only thing you can control. The feeling of powerlessness and helplessness and the feeling of having no control in your situation is so overwhelming that you can't even contemplate that there is a solution to the dilemma. The solution to the dilemma is less obvious and it's counterintuitive, and it's nevertheless a solution that is powerful and it turns the situation around. It's very often frightening and confronting if you all of a sudden start to see that there is a solution to your and your critically ill loved one's dilemma, and it all starts with you claiming your power and your level of influence back. The minute you've entered the doors to intensive care, you felt like you've given your power, control and influence away, and now is the time to claim it back. You claim it back by being crystal clear of what you want for your critically ill loved one. That could be as simple as making sure that your critically ill loved one is comfortable and pain-free. It could be as simple as making sure that you and your family make the decision of what you know is in the best interest of your critically ill loved one. After all, you know your loved one best, and you would have the best understanding what he or she would want in the situation that he or she is in. You would want to know that the treatment he or she is getting is exactly the treatment that your loved one would choose to get if he or she was in a position to make their own choices. Sometimes the intensive care team might suggest treatment that you may or may not be comfortable with. Therefore, be crystal clear on what your loved one would want if he or she can't make up their own mind. Don't let the intensive care team push you in a direction that you don't want to go and that you don't feel comfortable with. Take your time to think things through. The intensive care team often bases treatment decision on latest research, politics that are happening within the unit, the budget available within the unit, the culture within the unit, and also on their individual values, and all of those factors often don't align with what you, your family and your critically ill loved one want. It's so important that you feel that you have power, control and influence in your situation, and you also need to know that you have enough knowledge and power to make decisions in your situation. Don't overcomplicate things. The biggest mistake that you can make is to think that just because you are not a doctor or a nurse in intensive care that you can't get involved in the decision-making process. That's what you often hear from the intensive care team, and it often holds you back. In fact, the best decisions are usually made when the family of a critically ill patient in intensive care gets actively involved in the decision-making process. Otherwise, decisions are far too often based on research, politics, the budget and the culture within a unit, often leaving families and patients' values too far out of sight. So what does it exactly look like to always get what you want in intensive care? It could be as simple as making sure that you and your family have peace of mind by having enough time to say goodbye to your critically loved one if he or she is dying. Often end-of-life situations can be hastened and rushed, and families don't get enough time to say goodbye, leaving without that critical peace of mind. This may sometimes happen because the intensive care unit is in a rush to make the bed available for the next admission, already awaiting to come to ICU. After all, ICU beds are a scarcity. Furthermore, it also could be that if your critically ill loved one is expected to stay in intensive care for a long time, that he or she gets a quiet side room and also gets regular showers and visits outside as soon as his or her condition allows. Again, a lot more is possible if you simply ask for it. Don't be afraid to ask, and sometimes those little things can make a big difference for your critically ill loved one and for you and for your family. For more information and for more in-depth insight that you must know whilst your loved one is critically ill in intensive care, sign up for your free membership and get your free instant impact report. In this free instant impact report, you'll learn how to speak the secret intensive care language so that doctors and nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In this free report, you'll also discover how to ask the doctors and the nurses the right questions, how to eliminate fear, frustration, stress, struggle and vulnerability. You get 5 killer tips and strategies helping you to get on the right path to control power and influence in your situation. You will get behind the scenes insight so that you know and understand what is really happening. And you'll also learn how you need to manage doctors and nurses in intensive care, and it's not what you think it is. With your free instant impact report, you'll also get 4 other free reports that you will be receiving, and you'll receive the 6 questions you need to ask the most senior doctor in intensive care, 10 things you didn't know doctors and nurses are talking about while you're not at the bedside with your loved one, the 7 answers to the 7 most frequently asked questions if your loved one is critically ill in intensive care, and 9 myths of being a critically ill patient in intensive care. Thank you for tuning into this week's blog, and I'll see you again in another update next week. This is Patrick Hutzel from intensivecarehotline.com.